I want to talk a little bit about my background. So as Nick mentioned, I was a military intelligence officer. So that's my picture. I spent 5 tours in Iraq and Afghanistan, in a combat zone, but I really looked like this. I was more on the technology side. I led teams of software engineers. We were collecting hundreds of thousands of rows of data every single second. All this data was coming from very heterogeneous sources. Our job was to make sense of it, to build software applications on the front end of that data so that we could catch bad guys in real time. It was an incredible experience. I learned a ton about technology. Was able to leave NSA in 2007 and start my first company. It was a software company. It's based in Baltimore, Maryland, and we built software for the intelligence community, another really great experience. And then after selling that company in 2011, my hometown, which is based here in Ohio, a town called Gallipolis, Ohio, who's known for being kind of the home of Bob Evans, if you're familiar with Bob Evans, was having a really big problem with prescription drug abuse. And I was going to the funerals of my classmates. There were, friends of mine that were affected with this problem. My family was affected with this problem. And I thought there has to be a way to use technology to help it. And that was really my introduction into healthcare, and this was, again, about 2012. Fortunately, we knew the CEO of the local health system in my hometown, and they really allowed us to take a look around the healthcare systems that they had, the software systems. And after taking a look and seeing healthcare, we kind of knew what the problem was. Healthcare didn't have the internet. There was no connectivity. Systems didn't talk to each other. Software systems weren't connected. Nobody knew who a patient was. Nobody could have a longitudinal view of that patient over time. Nobody could see the drugs they had, the procedures they had. Nobody could tell if they were doctor shopping. There was really just no internet. And despite this lack of an internet, healthcare for many years had been building these really sophisticated routers. These routers to connect all the data together, but the routers look like this. So this is the healthcare router. It's the human. It's the human logging into systems after system after system, copying data, pasting data, pulling data out, putting data in, data extraction, data ingestion. It's the human as the router. And healthcare has built hundreds of these routers, thousands of these routers in some organizations. There are 16 million employees in healthcare. Healthcare is the #1 employer in the United States. More than retail, more than consumer packaged goods, more than oil and gas, more than manufacturing. It's the #1 employer. And it's the #1 employer for a large part because of this, because of the cubicle farms. When you go into a health system, you have the sea of cubicles with these human routers, taking data out, putting data in. And people are very proud of this. They're like, look at the empire, look at my kingdom of human routers. So we're trying to think about ways to take the robot out of the human, to keep them from being the router, to actually build a software robot that can pull data out of a system and put data in, can learn and can grow. So it wasn't healthcare. Healthcare wasn't the first to put the robot into the human. This guy was well known for doing that. This is Henry Ford, and as was mentioned earlier, the assembly line was one of those first places where we really saw the robot into the human acting like a robot, screwing the same screw, welding the same spot, putting the same piece on time after time after time. And this is what healthcare looks like today. Revenue cycle, finance and accounting, HR, IT, supply chain, all of those hospital operations. It's $1 trillion of the $3 trillion healthcare industry is simply these administrative tasks. These assembly lines exist in healthcare. They just look a lot different than this one did. Now, the interesting irony in all this is that our office, which is here in Columbus, our headquarters, is actually an old Model T factory and dealership. So that's kind of ironic. But if you think about this assembly line today, it looks nothing like this. It is automated. There are robots. The humans aren't doing the exact same thing. Automation has taken over the assembly line. And the same is happening slowly inside these big administrative offices with a lot of humans that do the same repetitive tasks day in and day out. So as we're building this software robot, this what we call a digital employee that goes into healthcare and takes over some of the jobs that humans used to do, things like claims processing, denial management, prior authorizations, eligibility checks, work in supply chain, all those repetitive, mundane tasks that humans used to do. We take cues as we're building, and we take cues from history. And the first cue is the wheel. The wheel was one of those scaling inventions. It allowed humans to do much more than they could before. It basically allowed us to work easier, to move large amounts of volume, of weight for farther distances. And we're doing the same when we're building our digital employee. We're taking cues from the wheel. We're able to do large numbers of tasks cheaply, efficiently, faster than we ever could. The next cue we're taking is the printing press. Another invention in human history that allowed us to scale, allowed us to do more, allowed us to share knowledge and share information, to share wisdom. And we are thinking about that as we're building our digital employee. We are creating a centralized brain for every single one of our digital workers deployed to hundreds of health systems across the country. This centralized brain allows us to collect all the memories of every digital employee in one place. So when one olive learns, all olives learn. It's a way of distributing information to every single one of our digital employees. And it's at the scale, taking the cue from the printing press, which led to the distribution of knowledge and information. The next cue is the engine. And the engine was really important. And the combustion engine, when it was created, it allowed us to, go from one end of the country to the other, to fly across the skies, to carry much more weight, to ship freight, to do much more. So this is what we think about when we're taking on transformational initiatives inside organizations. When we're going to a hospital and saying, we are not just going to take over automation or automated tasks, we're not just going to take over a lot of these administrative functions, we are going to be 30% of your workforce. 30% of your workforce will be digital. And this is the heavy lifting that our system is doing. The next cue is the computer. And why this is really interesting is because it allowed humans to not just process more data. The cool thing about the computer and why it was different from the mainframe was the fact that it was widely proliferated. You could put one on every single desktop, in every single house, in every single worker's desk. And it was that wide proliferation of the technology that made it so impactful. It wasn't the mainframe that changed the world, it was the personal computer. And just like that, we want to make sure that our digital employee is proliferated to the entire healthcare industry, to health systems large and small, to doctors' offices, to physicians' practices, to pharmacies around the entire industry, so that everybody can gain the efficiencies of automation. The next cue that we took in building our digital workforce was the internet. The internet, that's not a brain, that's an internet. That's the picture of an internet, by the way. So the internet allowed us to connect everything together. So what we imagine with our digital workforce is that every single employee, every digital employee, every software robot logged into every single system in every single hospital can all talk to each other. So imagine that. Imagine software robots logged into systems, able to communicate with each other, able to connect, able to share data, share information, able to pass data, pass information. So a hospital in Georgia with a digital employee could talk to a hospital in Texas with just the digital employees talking to each other. And that's the next cue. The final cue we took was the brain. So how do we make this smarter? It's not enough to build a digital employee that can go in and take over administrative tasks. It has to get smarter over time. It has to change, it has to adapt. So the way we think about it is a lot like the way the natural system works. The natural system, things that mutate can survive and continue to reproduce. And that reproduction causes evolution. That natural selection occurs, and that continues to be the thing that grows and mutates and continues to spawn new life forms and new adaptations. And we think of our systems the same way. When one olive mutates, when one digital employee does something different, because it's programmed to do so, and the outcomes of that mutation create better outcomes, that becomes the new best way of doing things. And then it continues to mutate and it continues to derive outcomes, and it continues to pick the best option, the most optimized option for the best outcomes. So that genetic modeling is how the software robots can get smarter over time, how they can evolve, how they can change. how they can start at one point of just taking on the task that a human does today, mimicking exactly what they do, to 6 months from then doing something way better, being smarter about how they're doing the work, not just mimicking the human, but able to perform at much higher scale than the human was ever able to scale. So at Olive, we have been basically putting this digital employee out into the world for about 2.5 years. We are in over 500 hospitals across the country. Our digital workforce is growing massively, taking on more tasks, getting smarter, sharing knowledge, sharing wisdom. And one of the things that when I go into these organizations, they often ask about is what happens to the human jobs and what happens to the human workers. And it was great that David was here today, because actually he doesn't know it, but his TED Talk was the inspiration that shaped my complete message to the industry. So thank you for that. I appreciate it. So that I was getting this question over and over again. I was like, well, how am I going to answer this question? And I looked, I Googled this topic, and David's TED Talk came up, and that became the foundation for what we talk about. So the message I want to leave you with, though, is that this is not just a technology investment. This is an investment in your current human workforce. They shouldn't have to do these tasks. They shouldn't have to be the routers. They should be able to do things that are more suited for humans, that involve human engagement. They should be able to bring humanity back to their jobs. They should be able to engage with patients in our case. They should be able to connect with them, provide better care, deliver better therapies, better drugs, better treatments. And that's what we're here to do. So thank you for your time today. Appreciate it.